guys, welcome back. Yesterday we have dealt about the local complications of LA, in which we have dealt about the transient facial nerve palsy, needle breakage, paresthesia, soft tissue injury. Now we will dealing with other local complications of LA and we'll completing today the local complication, and in tomorrow class we'll be starting systemic complication of LA. So let's start. Coming to hematoma, the effusion of blood into extravascular spaces. A hematoma developing subsequent to nicking of an artery usually increase rapidly in size, and when nicking of vein occur, it generally do not result in formation of hematoma. Okay. Now, tissue density surrounding the injured vessel is a determining factor कि how big or small the hematoma will be. What is the management? There should be direct extraoral pressure at the site, then ice application or cold moist towels each 20 minutes every hour. Okay, there should be cold application. In hematoma, there should be always cold application. Antibiotics for 5 days. Prevention. How can we prevent hematoma? Knowledge of normal anatomy. Use shorter needle for a PSA nerve block. It is the most common side effect or complication during PSA nerve block. Because it is a blind block, the hematoma chances increases. Minimize the number of the needle penetration and never use the needle as a probe in tissue. This many starting BDS or interns do this. This should never be used. Then coming to pain on injection. What are the causes? Careless technique, dull needles, rapid deposition of solution. Needle with barbs may produce pain while withdrawal. What are the causes? Careless technique, dull needle, rapid deposition and needles with barb. Now coming to management. Patient relaxation and stretching the mucosa when there is pain on injection. How can we prevent? Careful technique should be used. Sharp needle should be used. Topical anesthetic should be used. Slow injection. Rate of injection should be slow. And room temperature solution. There is two things, pain on injection and burning on injection. Both are different. Now burning on injection, what are the causes? It is due to pH of solution, rapid injection, contaminated solution or wound solution. What is management of burning on injection? It do not lead to prolonged tissue involvement. Formal treatment is usually not indicated. It is resolved by its own. Now prevention. Slowing the injection rate at 1 ml per minute should help. Okay, maximum you can go to 1.8 ml, which is approximate 2. Do not exceed the recommended rate of 1.8 ml. Okay, 1 ml per minute and do not exceed 1.8 ml per minute. Otherwise, it will cause burning of injection. Okay, now coming to next, infection. What are the causes of infection? Needle contamination, improper handling of armamentarium, that is the instrument we are using. Infection at the site of injection where there is already an infection at the site, and improper handling of tissue. Usual sign of infection is trismus. Trismus persists for 1 to 3 days. Swelling, fever, pain is also there. Okay. What are management? Heat and analgesic. In infection we give heat, and in hematoma we give cold compression. Remember this. This is very important. Physiotherapy as trismus is involved, and antibiotic if signs and symptoms persist. For example, swelling, fever persists, we should go for antibiotics. Now coming to next complication, edema. What are causes of edema? Trauma during injection, infection, allergy, hemorrhage or injection of irritating solution. These are all causes of edema. What are management? If there is minimal edema, analgesic for pain and it will resolve. If it is large degree edema and there is sign and symptom of infection, then antibiotic should be followed for 5 days. Okay, choice of antibiotic depends. Now coming to next, that is post anesthetic intraoral lesions. Occasionally occur 2 days after intraoral injections. Ulceration developed in mouth primarily around the site of injection. Okay, what are the management? Primary management is symptomatic. Reassure the patient that situation is not caused by bacterial infection. Okay, this is very important. You should make patient understand that is not a bacterial infection. It will resolve. No management is necessary if pain is not severe. If there is pain, we should go for topical anesthetic, and ulceration lasts for 7 to 10 days and it will resolve with or without treatment. Okay. Now coming to last complication, local complication of LA, that is sloughing of tissue, sloughing of tissue, which is a white scrap, which is not a painful condition. What is the cause? Prolonged ischemia secondary to use of LA with high concentration of epinephrine. If epinephrine we use in dental extraction, epinephrine in the concentration of 1:80,000, 1:1 lakh, 1:2 lakh. These are concentration of vasoconstrictor or epinephrine we use. If it is used in the concentration of 1:50,000, which is more concentrated, 1:50,000 is more concentrated than 1:80,000. If we use in concentration of 1:50,000, that it will lead to prolonged ischemia, which will lead to sloughing of tissue. What are the management? Observation, it will also resolve on its own in 7 to 10 days, and we can give analgesic if there is pain. So concluding this class for today and completing local complication of LA, will dealing systemic complication in the next class. Till then, like, subscribe and comment for the any